Okay, so today we are talking about the Regenexx stem cell and platelet-rich plasma treatments for knee injuries. Again, my name is Siddharth Tambar. I'm a physician here in Chicago. And goals of today's talk are the following. First off, to really compare what are the traditional care approaches to some of the more modern regenerative approaches to treating orthopedic injuries. To get a good understanding of what are some of the differences in terms of the Regenexx treatments with whatever else is out there. I'd like you all to get a better understanding of stem cells and platelet-rich plasma treatments and how we're using these treatments for knee injuries. I'm going to talk for probably about 20 to 30 minutes. Ask whatever questions you'd like. I'll try to address them toward the end, though. So, I'm going to present this with two cases and then sort of riff off of each one of those cases and talk more about the different treatment options. So the first case is a 32-year-old man who he works in finance, but he competes as a triathlete. He originally presented to me with left knee pain. His exam, ultrasound, and MRI document patellar tendonitis. He presented originally to me for treatment after he'd been referred by a sports medicine physician after he'd had continued pain despite physical therapy. So, there are a number of knee injuries that are common in cyclists and runners. Certainly soft tissue injuries, including tendons, ligaments, and then also the cartilage. It's my experience that if you treat the entire joint, not just the cartilage, but all the soft tissue areas as well, that's when you really get the best response in terms of effectiveness. So, the traditional care for someone like this would be rest, take some anti-inflammatory medications, a steroid injection, some physical therapy, and then eventually, if things are getting worse, eventually surgery. There are really a lot of problems with traditional care. Number one, this has been the kind of standard of care for decades, and there's clearly some better, longer-term options that we can pursue. From the standpoint of anti-inflammatory medications, while they work short-term, they really do not, they have too many problems long-term in terms of cardiac issues, stomach, liver, kidney. Steroid injections, while giving temporary pain relief, they can weaken cartilage and tendon tissue. Long-term, they have a lot of systemic side effects, including potential for diabetes, blood pressure, osteoporosis, and even affecting the adrenal glands. So they have a lot of problems long-term. The other problems with traditional care are that they don't really fix your problem. They don't actually modify your disease process long-term either, and they're really just meant for short-term treatment approach. And a better treatment approach are some of the regenerative treatments. A newer and more modern paradigm is to correct the biomechanics that's causing your original problem and to use some of the autologous biologic treatments, also known as regenerative treatments, such as platelet-rich plasma and stem cells, and that's what I'm going to be focusing on today. The advantages of the regenerative treatments are, number one, they're autologous, which means that they come from you, as opposed to a medication or a metal implant, which have potential for allergic reactions. These are treatments that come from you. You don't get an allergic reaction to your own tissue. They have limited risk as opposed to surgery, meaning there's no issues with, again, allergic reactions to material, severe blood loss. These are lower risk treatments. And in fact, I'll show some of the data from the Regenexx Network in terms of how low risk they are, that it's really similar from a risk standpoint compared to a normal injection. These treatments do have the potential to repair damage. And they also have the potential to actually modify your condition long-term. They're healthy for the joints and tendons long-term. Because of all of these above issues, there's really no limit to the number of treatments you can use. And they do take longer to work as opposed to steroid injections, which work immediately, but they do last longer as well. So coming back to my first case of this 32-year-old man, so I treated his patellar tendonitis with platelet-rich plasma for 2 treatments under ultrasound guidance, and he was able to return to his activity at full capacity. That's a really good outcome. 3 years later, he presented with right knee pain from a hamstring strain, which we detected based on exam as well as on ultrasound. Again, he had failed physical therapy, so we once again treated his knee, specifically the hamstring tendon, with PRP, and eventually his pain resolved, and again, he's back to his normal activity level. The things that I really want to emphasize in this kind of case are, number one, treating the soft tissue, his tendon injuries, with a regenerative approach is a really great approach to treatment here. And there's really nothing else that treats soft tissue injuries in the same kind of manner as these kind of regenerative treatments. Number two, we were able to treat him multiple times, and there's safety in that because he benefited each time a little bit more with each treatment. And all treatments, it should be said, need to be done under imaging guidance. The traditional way to inject a joint in a tendon is really just kind of blindly based on what you're seeing on the surface anatomy. That works okay if you're using steroid injections, but when you start using some of these more sophisticated biologic treatments, you really need to be doing this under imaging guidance. And the imaging modalities that are available now really make a lot of these treatments a lot more effective. So, the two kind of regenerative treatments that we're talking about are stem cells and PRP. First of all, I want to mention that, I am part of the Regenexx Network, and the reason why I joined the Regenexx Network a few years ago is because there's a lot of advantages to doing these kind of newer treatments in an organization like that. The network is basically a collection of physicians, about 25 physicians across the country, offering similar treatments with defined set protocols. We're tracking results, we're learning from each other in an organized manner in a field of science that is changing so rapidly, like stem cells and PRP and the regenerative treatments. Having that benefit of learning from each other is amazing. And in fact, the kind of treatments that we're offering today from a stem cell standpoint are dramatically better than what we were even doing 6 months ago. And it's that constant learning process within that kind of network that makes a really big difference. So the treatments that we're offering are the Regenexx same-day stem cell treatment protocol and some platelet procedures. And I'll go into details about both of these. As I mentioned, some of the strengths of this network: tested, consistent protocols. The protocols that we use for stem cells are tested. We're not extrapolating from somebody else's evidence. We're really using the same kind of procedure that we're publishing results on as well. Results that are being tracked for long-term efficacy and safety, and we're continuously improving these treatments, and again, focus on quality and safety of treatments. My general approach to regenerative treatments are the following. If you have a mild to moderate injury, I think platelet-rich plasma makes sense. If you have a more advanced injury, then the Regenexx same-day stem cell treatment protocol makes sense. In the platelet treatment protocol, how do platelets work? Essentially, after you have any kind of injury, your platelets normally rush in, recruit a lot of other cells and growth factors to assist in the repair process. So platelet-rich plasma is a biologic treatment where we essentially concentrate your platelets to a very high level, and injecting that under really focused manner, we're able to utilize the body's own normal repair process. What you develop is a very focused degree of inflammation, and that helps to repair tissue damage. There's two different types of platelet treatments that we're using. There's a traditional platelet-rich plasma. In the Regenexx lexicon, that's called super-concentrated platelets, where we essentially draw your blood, concentrate that to about 5 to 20 times your normal platelet level. Then injecting that into the area that's been damaged, you get a rise in the normal kind of healing growth factors over the next 1 or 2 weeks that help to repair that kind of injury. The second type of platelet prep that we use, which is a newer thing, is called platelet lysate, which is basically a version of platelet-rich plasma where we're actually able to crack open the platelets and just take the growth factors. Injecting that, you get an immediate increase in the growth factors. Combining these two platelet preps actually result in a lot better outcomes than just doing one alone. How does this work? Essentially, you get a blood draw, a few ounces that are taken out. We then prepare that into either a high concentration of platelets or the platelet lysate. We then use ultrasound guidance to place your cells directly into the injured area. And in my experience, gauging results at about 2 months is the right way to do this. The first week or so, people tend to be a little bit more inflamed, and it takes about 2 months to really get a full result from one platelet-rich plasma treatment. I generally tell people to expect to use anywhere from 2 to 3 treatments to obtain the best results. And in general, for mild to moderate degree injuries, this is a pretty good treatment. As I mentioned, as a standalone treatment for mild to moderate arthritis, tendinitis, or ligament laxity indication, it's a good treatment. And I do also combine this with stem cell treatments as well to treat not only the joint, but again, a lot of the soft tissue parts of the joint as well. There's good data that's been published on the efficacy in osteoarthritis compared to viscosupplementation treatments, the gel injections for knee arthritis. There's also good data supporting the efficacy for soft tissue injuries like tendinitis as well. And in my experience, it also helps to tighten any kind of lax or weak ligaments as well. All right, case number 2. So this is a 44-year-old woman who is actually a neuroscientist. She's an active marathon runner, and she had developed pain in her left knee. Her MRI showed a significant amount of cartilage thinning in the medial portion of her knee. She wants to avoid surgery because she wants to continue to be able to run, and she understands she's really just too young for knee replacement as well. So she proceeded with the Regenexx same-day stem cell treatment protocol. So what are the types of stem cell procedures that are currently being performed for orthopedic injuries? In the world, there's several different types of orthopedic stem cell treatments that are going on. The one that we're talking about today are adult stem cell treatments. Embryonic stem cell treatments obviously have some ethical issues, and they're certainly not legal in this country. iPSCs is a type of stem cell treatment called induced pluripotential stem cell treatments. It's actually a very neat idea. It's just too early in the research process, but it's basically taking normal cells and converting them into stem cells. It's a very interesting idea, but it's not really quite ready for treatment for people yet. So we're really talking about adult stem cells. What is an adult stem cell? It's a cell that is undifferentiated, has not become a specific type of cell. It's held in reserve by your body. You actually find stem cells throughout your body. And essentially the way that they're used is that when you have an injury, your body basically pushes in stem cells to help replace or repair tissue that needs to be treated. It can turn into a lot of different types of cells, and it can also help orchestrate the normal repair response. So essentially the way that we're using stem cells is if you have an injured area, by delivering your stem cells into that specific area that's been injured, we're helping to repair your injury in the normal kind of process that your body should be doing so. The protocol that we use for the Regenexx treatment protocol is really 3 different treatments. And it should be said that this protocol was basically, this has been refined since 2005 when the folks at Regenexx in Colorado had originally started doing this. It's gone through several different iterations, and this is the one that we're using currently. Again, it's important to note that as the science changes and grows and we understand more, these kind of protocols are constantly refined. There's a 3-treatment protocol. The first treatment is called prolotherapy, where we're essentially injecting a very low concentration of sugar water into a joint or ligament that needs to be treated. The benefit of that is that prolotherapy on its own helps to mobilize some of your own intrinsic stem cells. In addition, prolotherapy has the potential, by causing some low-level inflammation, that when we deliver your own stem cells, it makes it a much more friendly environment for those stem cells to stick. About 3 to 7 days later, you end up getting a bone marrow aspiration and a blood draw, and we re-inject your stem cells and platelet-rich plasma on that same day. And then 3 to 7 days after that, you get another blood draw and re-injection of your own platelets that same day. The purpose of that last injection is that it helps to feed the stem cells as well. So on the day of your actual stem cell procedure, you get a bone marrow aspiration from the back of your hip. You get a blood draw as well. In our lab, we basically isolate your stem cells and re-inject that same day. Getting back to the idea of learning and changing and getting better as the science evolves, the traditional way of doing these kind of treatments was to isolate what we call the buffy coat layer, where you have a couple different stem cell layers. A newer process that we're doing for the last 6 months as part of the Regenexx Network is we're now isolating another stem cell layer within that bone marrow aspirate. And what's exciting is that our stem cell count numbers are 5 to 7 times higher than what they were before. Now, what is the clinical utility of that? This is a little bit of a busy slide, but basically, by using the newer procedure, we're getting better improvement in terms of function, better improvement in terms of pain, and patients are overall getting a better result. So a newer, better method that you really can't get from an off-the-shelf kind of system has had significant impact on how our patients are doing. One thing that people always ask, if you're going to do a bone marrow aspiration, is that actually painful? When you actually look at, when we actually survey people how you done after a bone marrow aspiration, the vast majority say that it was a lot less painful than they thought, and they would certainly do it again in order to get a treatment. It helps if you've done a lot of these because naturally there's technique can vary if you have more experience or less experience, but really most people really don't do bad with the bone marrow aspiration. So who are our patients who are getting treated for, who are getting treated with the stem cell treatments? It's really a wide range of people, and it includes people who are low-level athletes, weekend warriors, professional athletes, people who've had injuries, people who are older and physically active. These are really the correct people to be getting these kind of treatments. But it includes regular folks who are physically active and people who've had injuries and are trying to repair or trying to heal from them. Safety is, as a physician, safety is unbelievably important to any kind of treatment that I'm using, and that's certainly a real emphasis within the Regenexx Network as well. When you look at the safety data that's been published by the Regenexx Network, as well as by another organization in Europe that's doing these kind of treatments, what you find is that these procedures are as safe as any other type of common injection procedure. It's important to understand that these are autologous, again, coming from yourself, so the risks associated if you were getting cells from somebody else, they don't exist here. You're not transferring anybody else's tissue. You don't have those kind of issues. It's also important to recognize that because we do everything on the same day, these are all compliant with FDA regulations. What do we treat? I'm essentially treating any of the peripheral joints, tendons, and some nerve entrapment conditions as well. The folks in Colorado and some people in the Regenexx Network are also doing some spine treatment as well. So getting back to the knee, again, my approach to regenerative treatments for the knee, treat the joint and the soft tissue injuries. From mild to moderate conditions, platelet-rich plasma can take 2 to 3 treatments. And for more advanced kind of issues, the Regenexx same-day stem cell treatment protocol makes sense. What's some of the data that we're seeing? And again, this is from within the Regenexx Network, from data that's been collected from patients that have been treated for their knee arthritis. The average improvement, and this is over, I think, around 1,300 to 1,400 patients, the average improvement at the 1-year mark is approximately 55 to 60% in terms of pain relief. And as you can see, that actually tends to improve even further as time goes on. The essential point to recognize is that these treatments are longer lasting than the traditional treatments that are available, and people do seem to, when they're responding, they do seem to trend better over time. Another way to look at this is what percentage of our folks are getting more than 50% pain relief. And the more recent data that we're seeing at the 1-year mark, about 65% of people are getting more than 50% reduction in pain. And again, that trends to be slightly higher as time goes on as well. This is kind of a busy slide, but basically emphasizing the improvement in function as well with these treatments. And by function, I mean things like being able to work, being able to participate in physical activities, as well as household activities and your running and your regular activities as well. There seems to be a significant benefit in terms of functional improvement as well with these treatments. So how does the Regenexx stem cell treatment stack up versus a knee replacement? So this question has actually been answered and looked into. Mitch Scheinkopf, an orthopedic surgeon here in Chicago, has compared his patients that had previously gotten a knee replacement versus his patients that got a Regenexx stem cell treatment. And what he found was that there's a similar improvement in pain between both groups, whether stem cell treatment or knee replacement. But an interesting difference was that the folks who got the stem cell treatment had a much better chance of getting back to their previous activity level compared to the patients who got knee replacement. So when you're comparing this kind of treatment, which is non-surgical, you have the potential to get a similar relief in pain as a knee replacement surgery without the same sort of risk associated with surgery, general anesthesia, blood loss, or having a piece of metal in the knee. And you have a quicker return to activity as well, a lower amount of downtime as well. And it's also important to recognize that even if you get this kind of treatment down the line, this does not preclude you from requiring surgery in the future if you required that. So with all the data that we're collecting, what do we know impacts outcome for a knee treatment? There's some surprising things. First off, what we found is that women who have more pain seem to actually have higher levels of response in terms of pain relief and functional improvement. Some things that we thought would actually impact degree of improvement really don't. So for example, older age, being heavier in weight, or even degree of arthritis does not seem to make a big difference. That was surprising. What does seem to make a difference is if you have a lot more joints involved. There is a potential to have less robust of an outcome. And if you think about that from a common sense standpoint, if you have only knee arthritis, treating that alone, you're probably going to respond better than if you had not only knee arthritis, but hip and ankle arthritis as well. You probably need to make sure that those other areas get appropriate attention to treatment also. Excuse me. So, you know, our folks who are getting treatment, they're now at the point where some of them feel like they need a second treatment. And what we found is that for those folks who get a second stem cell treatment, there is an additive benefit to that on top of their first treatment. And again, emphasizing that these are the kind of treatments that you can repeat, and that's safe to do so. So getting back to that second case, this 44-year-old woman, she got treated with the Regenexx same-day stem cell treatment protocol. She's had a significant reduction of pain, and she's able to continue running and exercising at her normal level. That's a great response. Someone who's had improvement in pain and is able to maintain their normal activities, including the ones that they enjoy doing. That's really a great outcome. So to sum up, there are certainly better and healthier ways to treat arthritis and tendinitis. A combined regenerative approach with change in biomechanics, I think, is the best and optimal way, non-surgical approach to treating arthritis and tendinitis. It's important to recognize that the science behind stem cells is rapidly changing and innovating and improving. Things that I think I would recommend you consider if you're planning on pursuing a regenerative treatment, when you're choosing a clinic, make sure you're using protocols that have really been used in thousands of patients and where data is actually being published in terms of how patients are responding. I think imaging guidance needs to be used. A lot of folks who treat patients do not use imaging guidance, and I think that's a major mistake. I think especially when you're using these kind of advanced treatments, you really want to use the best possible way to do it. And then lastly, the field is really changing pretty fast. You know, you want to make sure that you're getting the best, most innovative treatments that are available. And you know, there are organizations that give you that advantage as well. Okay. Let's see. Let me pull up the question area. Any questions? Okay, so the first question is, what is the cost? Does insurance cover? You know what? If you can email me directly at chicagoarthritis@gmail.com, we'll give you the full information in terms of cost and what's involved there. Unfortunately, insurance is not covered at this point, any of these treatments. While having an HSA account may get some coverage, we generally tell people you need to talk with your insurance company, but realistically, there is not a billing code for these kind of treatments, so there is not really consistent insurance coverage. The question about, there's another interesting question, when do I think insurance will get on board with paying for stem cell treatments? You know, it's a curious question because insurance pays for some things that are really probably not safe for patients. I don't know what it's going to take for them to eventually get on board with that. I think one challenging issue that they have is how do they make sure quality of care is being optimized. In the Regenexx Network, we can take care of that. We make sure everyone maintains that same level of quality and safety. I don't know how. I really don't know how insurance could maintain that. I think that's probably an area that that is a problem for them. Unfortunately, I don't really see insurance coming around in that regard anytime soon. I think realistically, probably the best chance to have insurance cover in the future is if, as a field, as physicians, if we find ways to appropriately credential and recognize providers as giving adequate care. That might be one way to sort of confirm that people are getting appropriate level of care. All right, next question is, how is a bone marrow aspirate drawn? So essentially, in order to obtain the kind of best quality stem cells for an orthopedic injury, we essentially take it from your bone marrow. And basically, we take it from the back of your hip. The way that I do that is by taking the ultrasound probe, finding really the thickest part of the bone in the back of the hip that has the best quality stem cells. That's our spot that we're going to take it from. We then numb down the area copiously, making sure that we can make it as comfortable as possible. And then essentially we take a sample right from the back of your hip from a couple different spots, and that's how a bone marrow aspiration is done. You know, by doing enough of these, I can tell you that there are ways to make it a lot more comfortable, and there are ways to make it a lot faster. And it's really not as bad as people think it is. Another question, what are the pre-treatment diagnosis techniques? Pre-treatment diagnosis techniques. I think what you're asking is, how are we making a diagnosis? You know, I think the keys to diagnosis are a couple things. Certainly getting a really good history. An exam is certainly helpful in terms of figuring out, do you have a lax ligament? Do you have a tendon that's injured? And imaging as well. For PRP, I don't think you necessarily need an MRI, but for the stem cell treatments and MRI, we definitely use that to guide us where we're going to be treating. Prior to any treatment, I'll end up using ultrasound to kind of figure out exactly what needs to be treated and what areas have been dinged up and where to focus our treatments as well. I hope I answered that question correctly. Any other questions? Okay, here's another question. Are X-ray or CT scans used? So if you mean for initial diagnosis and kind of mapping out we're going to treat, absolutely. For stem cells, you know, I require an MRI of the knee so that we can figure out exactly where we're treating. From the standpoint of guidance in terms of while we're doing the procedure, absolutely. I mean, I use ultrasound for most of my treatments, and I'll also use fluoroscopy or X-ray to help guide some other treatments as well. So again, imaging is an absolute mandatory aspect of not only diagnosing where we're treating, but also you know, actually delivering the treatments. Yeah, so you know, we do have patients who come from out of state, and it's a combination of things. For starters, actually taking a look at their imaging, talking to them over the phone as well, that at least gives us a good sense for what we're dealing with. You know, I think the things that make somebody a potential bad candidate for treatment would be if they have, if they're taking a ton of other medications that can be a contraindication to treatment, basically getting a good history over the phone, taking a look at the imaging is probably the first way to at least get a sense for what treatment would be recommended. And then obviously when that person comes in for their treatment, then doing their appropriate ultrasound examination at that time to make sure we're treating all the right spots as well. Where is the procedure done? So the procedure is done completely in the office. This is not something that requires hospitalization. Again, this is all done sort of the same day, each treatment. You don't require general anesthesia. Local anesthetic is more than adequate. Most people find that the treatment is tolerable and that it's not more painful than a regular injection. The next question is, what types of injuries do you find the best results? in my experience, if you have, you can treat soft tissue injuries like ligament tears, tendinitis adequately with these treatments, and even arthritis can respond pretty well with any of these treatments as well. So I don't think it's that there's one type of injury that responds best. I think it's a matter of making sure you treat everything that needs to be treated in that individual person. Any other questions? I hope I've answered everything correctly or appropriately. Okay, so someone asks, how do we proceed from here? Okay, well, two ways. Number one, if you can either go through my website directly. There should be a link to submit your information. Alternatively, you can write to me directly at chicagoarthritis@gmail.com, and we can give you instructions on how to proceed. Here's the other question. How many visits are typically required? For the stem cell treatment protocol, it's a three-part treatment, right? There's the prolotherapy, then the stem cell treatment, and then finally the PRP treatment. So that treatment cycle is 3 treatments. And then basically assessing a few months after to see how you're doing. So there's going to be the initial evaluation and then that 3-treatment cycle. For our folks that are coming in from out of state, we typically try to get everything done within a 5 to 6 day period. Chicago has a lot of great things to do, and so people have generally been able to stay busy in between treatments, and that hasn't really been too much of a problem. Anything else? Here we go. Can one drive immediately after treatment? I think it depends on which treatment process we're doing. I think from the, if it's prolotherapy or PRP days, then I think driving back home on your own is fine. The stem cell day, I think generally I recommend people have someone take you back. I've certainly had people that I've had some people drive back to Wisconsin, but I on their own after treatment. But I generally find that it's probably easier if you come with a friend or family member on the stem cell day, just because I think it's a little bit more comfortable that way. So here's a good question. How many years does this typically last? That's a really great question. And to be honest with you, what we found is it's variable. What we found is that there are some people who continue to improve over time, even at that 3 to 4 year mark. There are other people where they plateau at about that 1 year mark, and they may need another treatment. So it really depends on the person. And again, I think part of it is what's driving the problem to begin with. Is there a biomechanical thing that needs to be corrected, right? And in other people, it may be just their condition is more advanced where they probably would need another treatment after a year or two anyway. So here's another good question. Is cartilage regenerated in stem cell treatment? It depends. For a moderate degree of injury, I think that's certainly possible. For more advanced, it may or may not be. There are some MRI studies that have shown that after stem cell treatment, that cartilage can be regrown. I think from the standpoint of realistic outcomes, I think there are probably some injuries where if it's so advanced, I think if there's an expectation of regrowing that tissue significantly, I think that might be asking for too much right now. But from the standpoint of can you still improve pain and function in that person who still has an advanced amount of injury, yeah, that's still definitely possible. What else? Other questions? Okay, well, if there's no other questions, thank you everyone for tuning in. I appreciate this. This is actually my first webinar that I've done. I'm planning on doing more of these because I think the educational process for potential patients, I think, is fantastic. There's a learning process to these kind of treatments because it's a very different way of approaching care. That is much more long-term in nature, and it's a very different process. If you guys have any questions, you can certainly call or email me at any time. You can email me at chicagoarthritis@gmail.com. Check out my website if you want to just email through there. We've got lots of information on the website as well. And great. I appreciate your time, and hope everyone has a good afternoon. Have a good day.